So this, we're going to go over the bony surface anatomy of the wrist, both the dorsal and volar aspect. This is really critical, especially when you're performing your joint mobilization techniques, to have your hands in the right place, because there's a lot of small structures in this tight space. So we're going to start with, first, we want to place this wrist more in a maximal loose pack position. So I'm just going to roll this up a little bit. So he's in slight flexion, slight ulnar deviation. I'm going to first start off with finding the radial styloid. So if I come in, I go distal to proximal, and I come up and I feel what I think is the radial styloid. If I radially and ulnarly deviate, it should not move. So identify that and I mark it here. And then I'm going to follow up. Now, when I'm identifying the distal edge of the radius, I don't want to start proximal and go distal because there's a lot of little bumps on here, including Lister's tubercle. So I'm going to go here, coming more distal, pushing proximally here. So I'm going to come in here, and I'm going to draw out, and this is going to define that proximal border of our carpus. Here, I'm going to follow along until I reach a little divot at the distal radial ulnar joint line. And we're going to identify that in just a moment. So now I'm going to look for here, I'm going to bring him in either neutral or in full supination, and I'm going to find the ulnar styloid. So the ulnar styloid is, now I'm going to come in here. If I radially and ulnarly deviate, I'm going to feel it doesn't move. So I'm going to identify that here. And I'm going to draw that out. Then I'm going to bring him back into pronation, and I'm going to follow that along here for his ulnar head. Here, coming in. Good. And now to find the distal radial ulnar joint line, to confirm that, if I ask him to extend his small finger, that extensor digiti minimi is going to come right over the DRUJ line. So now we've identified the proximal border. So now we're going to find more the distal border here, and we're going to identify the CMC line, so where the base of our metacarpals reaches and meets the distal carpal row. So we're going to start with here, coming in. The ring finger is going to be a little easier because the index and middle fingers sometimes have a little carpal boss, so it's going to be a little harder to palpate. So we're going to come in going distal to proximal until we reach a little divot. And that little divot is the CMC line. This is very subtle, and sometimes it's very difficult to feel in your partner, so just be patient and try not to push too hard. You want to keep light pressure. Then we're going to follow up here, coming in, a middle, and index, and he has a little bit of a carpal boss, so instead of a little divot, it's a little more of a prominence. I'm going to find the small finger here. There's our CMC line here. And then I'm also going to identify here, because our first metacarpal is rotated, it's going to look a little different. It's going to look a little bit more proximal. So now what I'm going to do is I'm going to join that line. So then we've successfully outlined the borders of our carpus. Good. Next. Now what we're going to do is we're going to go in and we're going to find the width of the base of our metacarpals, because that's what we're going to use to help find our carpals. So we're going to come in between our second and third metacarpal. We're going to come down until we hit an area we can't go any further, and we're going to draw on what we call our V notch, because this is where the bases are going to be meeting. We go now in between here, the third and fourth, and here's our V, and fourth and fifth. Now we find here for the V notch at our first web space is going to be a lot larger because of the rotation of the first metacarpal, and it's a lot wider. So here's our V notch. So now from here, now we're going to come in and we're going to trace out the bases of our metacarpals. So we're going to drop a line down here, here. Good. And now we're going to outline our metacarpals. So I'll start here on the fifth. So here's our metacarpal shaft. We're just going to sketch out here the medial and lateral aspect. And here. So you have to move the extensor tendon out of the way a little bit. So here we see, here is the base of our fifth metacarpal, our fourth, Then we're going to come in here, our third, and then we find our second. Now our second's going to look quite large because we're looking at it from a dorsal and a radial view because the first metacarpal has rotated out of the way. So it's going to look a little wider, but don't be alarmed. That is correct. Here, coming in, and then our first metacarpal. Here. Okay, good. So now we've got our metacarpals, and we're going to now take our dorsal compartment and we're going to split it up into, we're going to put some arbitrary lines. So you don't have to palpate anything, but we're going to imagine this is a pan of brownies, okay? And we want to cut the brownies so we have 9 equal boxes because we don't want the kids to fight that one brownie's bigger than the other. So what we're going to do is we're going to take this distance and we're going to draw in 2 arbitrary lines. Here and here. Okay, then we're going to do another set of lines. We're going to go now instead more vertical, and again we're going to split them up, so then we have 9 brownies here. Perfect. Okay, so what we're going to do next is we're going to start with looking at putting in some of our carpal bones. So we're going to start with our capitate first. Our capitate is our largest carpal bone. It's the keystone of the wrist. So we're going to come in, we find that just wider than the base of our third metacarpal, coming down, and it's going to take up 2/3 of that brownie right here. So all of this is the capitate. And we're going to put a C on it here. Okay, good. And our next structure we're going to find, first we're going to find Lister's tubercle, and that's going to help us identify the lunate. So our Lister's tubercle, if I ask him to bring his thumb up into retro position, I'm going to find the EPL tendon. That wraps around. Here is his Lister's tubercle. Good, and relax for me. Some are more prominent than others. So here's our Lister's tubercle. So now to find our lunate, what we're going to do is we're going to go half the distance between Lister's tubercle and the distal radial ulnar joint, and now we're going to draw in our lunate right here. So remember the lunate's quite a large bone, but it looks smaller when we're looking at it from an anterior and posterior position. What I want you to appreciate from here too is how ulnar it is. It's not in the center of the wrist. Okay, now we're going to take a look at our scaphoid. Our scaphoid, as we know, rests in 30 to 60 degrees of flexion. And we're looking at this 2-dimensionally versus the 3D structure. So it's going to look huge. So we find here on the radial side of that distance between the capitate and our distal radius is going to be scaphoid. So this is all scaphoid here, as well as the proximal 2/3. So this is the dorsal compartment here. This is all scaphoid. And if we look on the radial side here, 2/3 of this distance is also the scaphoid. So it looks massive. But we remember that this is resting in a flexed position. Good. Okay. So now we're going to look at trapezoid. So the trapezoid is going to be the width of the base of the second metacarpal, and because it's a smaller bone, it's going to just take up just here that distal portion. So this is going to be our trapezoid here. Okay, good. And now we're going to find here on the ulnar side, we're going to find our hamate and triquetrum. So there are different shapes of triquetrum. Some are more squared, some are more rounded. So to help to find that border between hamate and triquetrum, we're going to go from the distal corner of the lunate to the base of the fifth metacarpal. So right here. Good. So now we find our triquetrum is going to come in here, and his is a little more squared off. So I palpate, it feels bony. Sometimes it's very rounded and it doesn't feel like a whole lot right there. But here's our triquetrum here. Put a little Q there. And what we have left here on the ulnar side is our hamate. And we're going to be identifying that from the volar aspect as well. So there's our hamate. And now I'm going to turn him, and I'm going to ask, so in this position we cannot palpate the trapezium. So what we need to do to expose that, because at the base of our first metacarpal is covering that. So if we ask him to bring his thumb across his palm, now that's going to expose the trapezium. So the trapezium here I'm going to draw out here it's that little sliver, and sometimes it can be more tender on patients, so we want to be careful. Good. Perfect. So we have now identified the dorsal bony surface anatomy for the wrist. Now we're going to take a look at the volar aspect. So now let's go in, okay, and we're going to find here first our scaphoid tubercle and our pisiform. So let's come in first and let's find here, relax for me, we're going to find our pisiform. So if I have him hold, don't let me move you, I find his flexor carpi ulnaris coming up. It's going to run into here, our pisiform bone, and relax. And the pisiform is larger than we think. So we think about it being a P-shaped structure, but it's actually a little bit bigger than that. I'm going to use the blue here. So pisiform here. I'm going to draw that out here. And now, to find the hook of the hamate, what we're going to be doing is I'm going to look at the distance from my IP crease of my thumb to the thumb tip, and his is just a little bit longer. I'm going to place my IP joint over the pisiform, and I'm going to go a little bit further, going in a diagonal toward the base of my index finger at the MP crease. I'm going to come in, and I should find my hook of the hamate right in that area, and sometimes it's tender. Patients will say, ooh, I can feel that little numbness or tingling, a little zip. That's the hook of the hamate. So here I have the pisiform. Here I have the hook of the hamate. Okay, and now we're going to go to the radial side. Here I'm going to come in and I'm going to find the scaphoid tubercle. So the scaphoid tubercle and trapezium tubercle are kind of like a mountain, and the proximal aspect is the scaphoid tubercle, the distal, the trapezium tubercle. We're going to be able to palpate the scaphoid tubercle much more easily, because when we think about arthrokinematically, as we bring the wrist from an ulnarly deviated to a radially deviated position, what happens is the scaphoid has to flex to get out of the way so it doesn't run into the radial styloid. So if I place my hand here, I'm right on the wrist crease, and I put my index finger there, I'm going to feel a prominence. That's going to get larger as I radially deviate. And that radial deviation is allowing for, now I'm feeling the distal pole of the scaphoid become more prominent. So I'm going to mark that here. That's the scaphoid tubercle. Okay, I'll put a little S there. And then just distal, when I ulnarly deviate, now the scaphoid's going to extend out of the way. And what I feel then, just distal to the scaphoid tubercle, is my trapezium tubercle. Here. Okay, much more subtle. So if you have a difficult time feeling it, that's normal. It's much easier to identify the scaphoid tubercle. So now what we're going to do is we're going to take a look here at the trapezoid. The trapezoid we cannot palpate from the volar aspect because of that thick soft tissue. So what we're going to have to do is we're going to have to extrapolate. So I've identified the trapezoid dorsally. I come in and I'm going to find it just ulnar to the trapezium tubercle, and it's just going to be a little sliver right here. So this is going to be my trapezoid. Here's trapezoid, okay, and then here is the trapezium. Okay, now we're going to find our lunate. So how we find our lunate is we're going to go from the ulnar styloid to the radial styloid, and we're going to draw a little line here. Okay, so I'm just going to draw a little dotted line here. And our lunate is going to be along that line just a little ulnarly. So if we come dorsally and look, here we are. This is our lunate right here. So it's, again, more ulnar than we can give it credit. It's not quite in the center of the wrist. And then the last structure we're going to find is the capitate. So we're going to find that capitate by going from our scaphoid tubercle to our hook of the hamate. So I'm just going to draw a little line here from scaphoid tubercle to hook of the hamate, and our capitate is going to be right along there. And again, this is a larger bone here. So now we are all set up to be able to do our manual techniques. We found scaphoid tubercle and pisiform, and we're going to need that when we stabilize the proximal row. When we do some of our radial column techniques, we can find our scaphoid, we find our trapezoid. We're going to be able to test for that motion in the mid-carpal joint, as well as coming in and finding our lunate when we do our scapholunate ballottement test or lunotriquetral ballottement.